Discussion of the muscles of the back of leg. Back of leg, it is also called the flexor compartment of the leg. This is the left lower limb. This is the medial side. Here you can see this is a towards the great toe. It is the medial side. This is the lateral side. This is the medial head of gastrocnemius. This is the lateral head of gastrocnemius. And below it there is a soleus. And here you can see this is a plantaris. These are the four muscles united. It makes a tendo Achilles. And this is the most just behind to the medial malleolus. This is a tibialis posterior. After that, this is a muscle. It is called the flexor digitorum longus, and this is the flexor hallucis longus. So these are the muscles of the back of the leg. Now we will discuss one by one. This is the medial head of gastrocnemius, which arises from the posterosuperior depression on the medial condyle of the femur, behind to the adductor tubercle. Here this is the adductor tubercle. Behind to it there is a posterosuperiorly there is a depression on the femur, on the medial condyle of the femur. It is the origin of the medial head of the gastrocnemius. Lateral head of the gastrocnemius, which is arise from the lateral supracondylar ribs. It also arises from the capsule of the knee joints, and it also arises from the lateral surface of the lateral condyle of the femur. So this is about to the origin of the medial and lateral head of the gastrocnemius. Here you can see over the femur, you can see this is the medial head of the gastrocnemius lies over the, this is the adductor tubercle. Just below to the adductor tubercle there is a origin of the medial head of gastrocnemius, and this is the lateral supracondylar ribs and the area behind to it and capsule. This gives the origin of the lateral head of the gastrocnemius, and there is a origin of the soleus from the, this is the soleal line. It gives the origin of the soleus muscles, and here you can see this is a it gives the origin upper 1/4 of the posterior surface of the shaft of the fibula. It gives the origin of the soleus muscles. So upper 1/4 of the posterior surface of the fibula, as well as there is a, it gives the origin of the it gives the from the soleus line, and all four muscles are inserted on the middle of the calcaneum. It gives the insertion of the tendo Achilles. Now another muscles we reflect the tendo Achilles. After that you can see this is the muscles which is the tibialis posterior. It is the first muscles, tibialis posterior, which is arise from the upper two-third of the lateral part of the posterior surface of the tibia below to the soleus line. Here you can see this is the below to the soleus line. This is a below to the soleus line. This is a posterior surface, and this posterior surface there is a vertical line you have to draw, and this posterior to this part of the tibia, lateral part of the upper two-third part of the posterior surface, it gives the origin of the tibialis posterior muscles. And this tibialis posterior muscles, which is inserted on the navicular bone. Here you can see this is the navicular bone, tuberosity of the navicular, and this from the navicular it gives the slips to the all tarsal bone except talus, talus, and also it gives the slip to the metatarsal bones. Another muscle, it is the behind to it there is a flexor digitorum longus. This flexor digitorum longus, which arises from the upper two-third part of the medial part of the posterior surface of the tibia. This is this part of the tibia. It gives the origin of the flexor digitorum longus, and also below to the soleus line. Medial two-third of the medial part of the posterior surface of the tibia, upper two-third part below to the soleus line, it gives the origin of the flexor digitorum longus, and this flexor digitorum longus, which is inserted base of the distal phalanx of the lateral four toes. Here you can see base of the distal phalanx of the lateral four toes, it gives the insertion of the, on the plantar surface, it gives the insertion of the flexor digitorum longus. And the last muscles, it is the flexor hallucis longus. Flexor hallucis longus, it is lower 3/4 of the posterior surface of the fibula. Lower 3/4 of the posterior surface of the fibula, it gives the posterior surface of the fibula, it gives the origin of the flexor hallucis longus. Here you can see this is the flexor hallucis longus, the muscle which is the flexor hallucis longus. You can see this great toe which is flexed over the. So this flexor hallucis longus, which is inserted on the base of the distal spalings of the great toe on the plantar surface. So all these muscles which is innervated by the tibial part of the sciatic nerve. Here you can see this is a tibial part of the sciatic nerve which innervate to the all these muscles. Here you can see the nerve to the this is the sural nerve. This is the cutaneous nerve. It is a sural nerve, and from the common peroneal it gives the sural communicating and it makes a sural nerve. Here you can see this is a sural nerve, and the branches to the, this is the lateral head of the gastrocnemius, branches to the soleus muscles. It gives the branches to the medial head of the gastrocnemius. So, and later on the tibial nerve, it also supplies innervate to the muscles of the back of leg, deep muscles of the back of leg, which is innervated by the tibial part of the sciatic nerve. Here you can tibial part of the sciatic nerve, which innervate to the tibialis posterior, flexor digitorum longus and flexor hallucis longus. Even the tibial nerve, which innervate inside the back of the thigh to the tibial part of the sciatic nerve, which innervate to the semitendinosus, semimembranosus and long head of biceps, and hamstring part of the adductor magnus. Hamstring part of the adductor magnus, which is innervated by the tibial part of the sciatic nerve. Only the short head of biceps, which is innervated by the common peroneal nerve. So these are the muscles of the back of leg, and here you can see this is the popliteus muscles, triangular muscle. It is a popliteus muscle, and here you can see this is the nerve to popliteus. Here you can see this is the nerve to popliteus. It is goes deep inside and it enter inside the popliteus from the deep surface, and it supplies to the popliteus. And the popliteus muscles, which is arise from the lateral surface of the lateral condyle of the femur. Lateral surface. So it arises from the lateral surface of the lateral condyle of the femur. Here you can see, and it is inserted over the above to the soleal line, above to the soleus line. It gives the insertion of the popliteus muscles. So here you can see this popliteus muscles, which is arise from the lateral condyle of the femurs, and it is inserted on the popliteal surface of the tibia over the, above to the soleus line, above to the soleus line. So this is above to the back of the leg, and muscles of the back of leg, and now innervated by the back of legs.